It's a Tuesday morning in Ileoluji, a modestly populated town in an ancient part of Ondo State, western Nigeria. Cars and motorbikes honk their horns as the people of the town go about the day's business. In one of the houses that line the main street of the town, Mrs. Olorun Fumibi, a veteran nurse and midwife, examines a sick baby. Concluding her examination, she offers some advice to the parents and urges them to take the baby to the health center for further examination. For a long time, infant and maternal mortality have remained one of the biggest challenges facing Nigeria's health sector, and with 560 maternal deaths per 100,000 live births in 2013, approximately 1 in every 9 of such deaths occur in Nigeria alone. Majority of these casualties occur in the rural and semi-rural areas where the people have little or no access to proper health care, and the health centers are ill-equipped to handle deliveries and birth-related complications. Until very recently, the health center in Ileoluji was no different from other ill-equipped primary healthcare centers in the country, and this resulted in very low patronage from community members who had no confidence in the public health sector.
When I got here, this place was so terrible. People were not patronizing this place because the condition of service here was so poor. By then, we don't even have patients. So, for a whole month, we may not have more than 3 deliveries.
Due to the state of the Ileoluji Primary Healthcare Center and other poor conditions of service, patronage was very low, and this also affected the morale of the health workers. But this problem was not peculiar to just Ileoluji. It was a nationwide problem which ultimately impacted negatively on the nation's health indices. Nigeria at a time contributed to 10% of all global maternal deaths.
For many years, primary health care has been very ineffective and inefficient in terms of being able to deliver to the community basic essential healthcare services. The community have lost confidence in primary healthcare over time. And that of course explains why our health indices and statistics range among the poorest worldwide.
So in 2013, in an effort to accelerate progress on reducing preventable maternal and child deaths, the federal government of Nigeria adopted a radical new approach to primary healthcare delivery through its Nigeria State Health Investment Project, NSHIP, a 5-year program supported by the World Bank, and one of the first states chosen for the pilot phase was Ondo State.
NSHIP actually came into Ondo State in 2011. It's a results-based finance project in which health workers are being incentivized by the work they do. Before the project started in Ondo State, the health workers, they have to, irrespective of whatever they do, at the end of the month, their salary comes and nobody is assessing how much they have done, how much they have invested into the services. But since NSHIP had started, that's put in place a system in which the quantity of service of work a health worker has put is being assessed. And also, we also look at the quality of the work they are putting in as well.
Unlike previous health-related interventions, NSHIP came with a unique approach. The aim was to reward health facilities and health workers based on their performance. Using a method known as performance-based financing, PBF, NSHIP was aiming to finance results rather than input. For most health workers in the state, this sounded a little too good to be true. To kickstart the project in Ondo State, selected health facilities each received a seed grant, and thanks to the NSHIP model, for the first time in recent memory, each health facility had autonomy to decide how exactly they wanted to spend their funds. Based on their most pressing needs, everyone went to work, and with the majority focusing on giving their facilities a much-needed facelift.
We thought it was a joke by then. We went to the local government secretariat. It was then we believed that something is happening. When they were distributing check to individual health facility, they said take off grant, and we were given 410,000. Wow, and I'm so happy. The first thing is that we renovated our labor room. We first of all painted the wall. Then we did the tiles. Then we buy some major equipment that are needed.
Apart from giving their health facilities a facelift, many health workers had to go out of their communities to engage with community members and build trust and confidence. Slowly but steadily, the community members started to visit and patronize the health centers.
We were making a move that people should come here. Things have changed, and so they were coming. The people that came today will tell other people, that place is no more maternity. This place has changed. We have never experienced such thing before.
It's a Wednesday morning, and already the Comprehensive Health Center in Ileoluji is already teeming with women and babies who have come from far and near to receive antenatal services.
NSHIP has given these health facilities autonomy to take a lot of decisions on their own. This has been able to help them a lot because it makes them to take ownership of the service they are rendering. They don't see healthcare service delivery like the service of the government. They see it as their own service because they are actually involved in the day-to-day running of it.
We have seen unbelievable improvement in the attitudes of workers, health workers, the same people that once upon a time you hardly will see them at the clinic, especially on weekends. And these are the same people now, day and night day. Some even want to sleep in the facility.
Tẹ́lẹ̀, nígbà tí mo ti ń bímọ, ó ti pẹ́, mo wá síbí fún ọmọ bíbí. Ibi mọ gbogbo ọmọ mi bí mo bí wọn sí. So mi wá síbí, instead of bíbí màá lọ sí general. Nígbà yẹn, bẹ́ẹ̀ nígbà tí wọ́n ti wá modernize ẹ̀ bí eléyìí, doctor wà níbí báyìí. Doctor sí tẹ́lẹ̀. Àwọn nurses wọ́n pọ̀. So wọ́n ti modernize ẹ̀ dáadáa jù ti tẹ́lẹ̀ lọ. Ó ló jẹ́ kí everybody wá síbí.
Màá wá fún ìfúnpá mi, wọ́n á ṣe fún mi. Nígbà tí wọ́n ti ní doctor, mi worry àti máa tó lọ sí hospital mi màá wá síbí.
Tó bá dẹ̀ débí ní 24 hours a day, bàbá nọ́ọ̀sì, bàbá òṣìṣẹ́, àní tí dárí tabari patient tó jẹ́ pé ara ọwọ́ nọ́ọ̀sì ò ká, wọ́n á pe doctor adẹ́wà, á tẹ́ǹdì sí. Tó bá jẹ́ ilé tó máa admit, tó bá dẹ̀ jẹ́ ilé tó máa treat yẹ kó tọ́gùn fún wẹ́, á kọ́ fún. In fact, one try.
The success of the NSHIP model lies in its unique approach to reward health facilities based on their performance. Each health facility has a list of services that they are required to provide to the patients, and when these services are provided, the health facilities are then paid directly. This approach to financing is better known as performance-based financing, or PBF. In the PBF approach, payment is explicitly tied to the delivery of pre-agreed health services, and because the health officers know that their funding is closely tied to the quantity and quality of the healthcare service they deliver, they use the funds they receive to create a more conducive environment for the women and children and reward the hospital staff, who in turn are now motivated to dispense better healthcare. So for the healthcare workers, the more patients they can accommodate and care for, the more they can earn. Since payment is based strictly on the quantity and quality of healthcare that the health facilities claim they deliver, one critical component of the PBF approach is the verification process. Before payment can be made, the health facility must first declare the quantity of services provided using a register. Only after the claims have been verified and validated can payment be made. And so it is very critical to the success of NSHIP that the verification process be transparent and of a very high standard. To achieve this, a team of men and women now work as verifiers, collating and analyzing data, and also providing mentoring and coaching for the hospital staff, guiding them on how to properly prepare their business plans and invest their funds to deliver better results. In this unique approach to financing, even the communities have a role to play in ensuring the continued success of the health facilities. Each primary healthcare facility under the NSHIP project is mandated to have a committee made up of members of the community and healthcare workers who meet regularly to deliberate on ways through which the health facilities can improve and deliver better services. The success of the NSHIP project is also evidenced by increased referrals from primary to secondary healthcare facilities. The State Specialist Hospital in Ondo State, for example, was one of the 18 tertiary institutions that received funding under the NSHIP project. With better facilities and a highly motivated workforce, the hospital has seen an increase in the case referrals from primary healthcare facilities.
The referral system, per se, you refer from one level of healthcare to the other. Now the primary healthcare system, now the secondary. So any case that you cannot handle at a lower level, you refer to the. That's what I mean by referral. It has improved our relationships with the people at the primary healthcare sector. Secondly, money is attached to the coupon. The referral slip that we normally sign and send back. At the end of the day, they know it translates to some points. So they key into it. Then the better for the patients. Because before now, for fear of being castigated, some people might not even bring these patients and they will die. So those are the areas I think it has really succeeded.
So far, the NSHIP program has recorded resounding success in Ondo State, with over 578 health facilities in the state benefiting from the initiative. Almost 2 million women and children have received quality health care from the public health centers, with more than 100,000 safe deliveries and 250,000 children completely vaccinated.
I remember very vividly, we confronted the Governor Mimiko, that Ondo State, as far as health is concerned, was like the last in the Southwest. So we developed NSHIP, there on. In the last 6 years, survey after survey, Ondo State has been the most improving in the Southwest. We're quite impressed, I'm sure you will have seen before and after of many things in Ondo State.
Healthcare indices in Ondo State are much better now, and for thousands of healthcare workers like Mrs. Olorunfumibi, this novel approach of rewarding performance has encouraged them to work harder, give better care, and ultimately restore the confidence of patients in Nigeria's healthcare system.